Knock knock. Can I come in?
Yes.
Alright, hi there. My name is Paul Conway. I'll be your nurse practitioner. What's your name?
I'm Chip. Pleasure to
Hi
meet you.
Chip. I'm just gonna wash my hands over here. Okay. So in this exam, I'm just gonna be doing your focused cardiac exam and also a peripheral vascular exam. Is that okay?
Yes.
Okay, perfect. Alright, and first I'm gonna explain exactly what I'm gonna be doing the whole exam. So just in the entire exam, just gonna talk to you through it. So first I'm just gonna look at your chest inspection, look at your, make sure it's symmetrical, no deformities, scars, no cavitations in your chest or anything like that. And it looks normal, looks symmetrical. The next thing I'm gonna do is I'm just gonna palpate your chest. So is it okay if I touch your chest?
Sure.
Perfect. So I'm going to start here in the pulse, point of maximal impulse, right here, the fifth intercostal space and mid-clavicular line, and just I'm going to feel for any thrills or heaves, and that feels normal. I'm going to go over here to the left sternal border and palpate and feel for any thrills or heaves, and that feels normal. And also the pulmonic area, same thing, and aortic, and that all feels good. Now I'm gonna do I'm gonna auscultate the 5 points of the chest. It's gonna be the aortic is the second intercostal space, right sternal border. The pulmonic is the second intercostal space on the left sternal border. And then Erb's point is the third and fourth intercostal space on the left sternal border. That's also where you can hear the tricuspid valve. And then the mitral valve is also at the apex of the heart, and that's the fifth intercostal space and the mid-clavicular border. So I'm going to feel first with the, I'm going to listen first with the diaphragm and then the bell. And what I'm listening for is normal, just S1 and S2, and that's systole and distole, diastole. And I'm listening for any adventitious lung sounds like murmurs or rubs. Walk my stethoscope down. And I'm listening also for rate, rhythm, and quality. And making sure it's regular. And now I'm going to flip over my stethoscope to the bell. I'm going to listen at the mitral valve. And I'm hearing S1 and S2. I don't hear any extra long heart sounds. This is the tricuspid and pulmonic. And aortic. Okay. Now I'm just going to have you lay flat on, lay supine. So scooch down on the bed, and you're going to be completely laid flat. And I'm going to be doing the exact same thing, but at this point I'm going to look at your precordium and making sure there's no thrills or heaves or anything in your chest, any ventricular pulsations on his chest. And it looks good. No, it looks symmetrical. Okay, I'm going to go again. Start at the aortic with the diaphragm, second intercostal space, right sternal border, and pulmonic, and moving down. This is also called the second pulmonic space or Erb's point. Walking down, listening, and right there. And I'm going to do the bell, work my way back up, tricuspid, Okay, and then now I'm going to have you lay on your left side. And I'm also going to palpate. Palpate first on your left side. And these are going to be the 5 points that I just talked about. So we're going to feel. And also you can really feel the point of maximal impulse. The apex of the heart right here. Because the heart falls down and it feels, and it's against your chest wall. It's a little bit easier to feel. That feels good. I don't feel any thrills or anything like that. I'm gonna listen now. Same thing. Aortic. Pulmonic. And work down his chest. And we're just gonna scoot you a little bit more towards me. There you go. And there's mitral valve, and I can really hear that. That sounds good. Normal S1, S2. No adventitious lung sound or heart sounds. On the bell, tricuspid. Pulmonic. And aortic. Very good. Okay. All right. Now I'm going to have you lay back and sit up again at a 30-degree angle. And now I'm just going to assess your peripheral circulation. So I'm going to start with your carotids. Okay. I'm going to turn your head to the right, left, and I'm going to assess your JVD. And usually I can measure this too with a tape measure in the office. And I would do that if I suspect you have an increase in JVP. So first I'm gonna feel for the pulse of the carotid, and what I'm doing is I'm feeling for rate, rhythm, contour, amplitude, and also symmetry. So I only do one of the carotid pulses at a time. That way I don't cut off the blood circulation to his brain. And those are about 2+, and they're within the regular rate, between 60 and 100, and it's also like a 2+ for his amplitude. All right, now I'm gonna go down his extremities. So I'm gonna first look at his extremities, noticing any skin ulcerations or changes in hair distribution or pallor. I can use the backs of my hand to feel, and he's nice and warm all the way up. There's no changes. He has very good vascular, like in his hands, his veins are showing, so he has a really good vascular circulation distally. So I'm gonna feel his radial pulses. So and I'm actually gonna feel them both at the same time. And those are about a 2+, and the rate and rhythm is regular, and it's between 60 and 100. Again, is brachial, feeling for the same thing. And those are 2. Now I'm going to go down to his distal extremities. Now I'm going to keep them covered, so I'm just going to feel over. If this was in the office, I'd feel for the femoral pulses underneath his gown, and that's regular. That's 2+ or 2. That's normal. Go down. This is going to be his popliteal artery, so I'm just going to reach behind. He's going to do a little bend in his knee. Feeling again for rate, rhythm, and contour, amplitude, and they are symmetrical. I'm going to go down dorsalis pedis on the anterior of his foot. Again, feeling for the pulse. And those are 2. And they're both symmetrical. And the posterior tibial. And it's located on the medial malleolus. And those are both 2. And they're symmetrical. And that concludes the cardiac and peripheral vascular assessment. Thank you for your time, Mr. Conway. And I'll see you next visit.